And I'd like to welcome Jessica Grossmeier, who's Vice President of Research for HERO, and Nikki Hudsmith, who's Vice President of Operations for HERO. Welcome to the program, both of you.
Yeah, thank you for having us.
Thank you. Good morning.
Good morning. Now, as Jonathan and I were talking early in the segment, give our audience a little bit of a background on HERO, and then want to ask you, some more questions on the new survey that you guys produced.
Yeah, certainly. So HERO is a not-for-profit organization. It has been around for about 20 to 30 years, and the organization is very much focused on supporting employers on demonstrating the evidence base for why employers should invest in employee health and well-being. The organization is made up of not just employers, but also consultants, brokers, vendor suppliers who serve the field, as well as researchers.
Now, Jessica, why did HERO initiate this research that you all conducted?
Well, HERO conducted this study to better understand how a range of business leaders at various levels within an organization view the link between workforce health and productivity in particular, and also to better understand if business leaders differentiated between the concepts of productivity and performance. We've been hearing about this link for many years, and what we didn't understand is why this idea might not be gaining traction with business leaders. And so it was important for us to focus on understanding how they view these connections.
That's great. Nikki, tell our audience a little bit about the types of organizations and executives that you spoke to, and a little bit about, the methodology behind the research as well.
Absolutely. So when we started out this effort, we felt that it was really important prior to fielding any kind of survey to gather additional information. We really just wanted to better understand what kind of questions we're going to get at what we were looking for, which was really better understanding the connection between health performance and productivity. So we started by conducting some telephone interviews with about 15 senior-level executives, and these folks included senior vice presidents, presidents, CEOs, CFOs, and other senior executives from a lot of different industries. We included industries like healthcare, financial services. We even had a few from the education sector. We also had manufacturing and even government and professional services. And these organizations ranged in size from about 130 on the low end in terms of number of employees, all the way up to 66,000. So we really felt like we got a good representative sample on industry and organization size, and the purpose of these interviews were really to better understand what was on the minds of CEOs and other senior-level executives in terms of health, performance, productivity, and the connection between the three. Once we had gathered the qualitative information from those interviews, we actually were able to leverage 7 different survey distribution partners and their networks to collect over 500 online survey responses from leaders in a very wide mix of roles, industries, and organizational sizes. One of the things that we were really excited about was most of the responses that we got on this question set actually came from organizations outside of the HERO spectrum. So we felt like we got a really, really broad reach into business leaders across the country, across different industry sizes, organizational types.
Jessica, when you guys were going in to conduct, this study, what were you hoping to learn, and then what did you actually find out once the study was concluded?
Well, it was really a rich source of information, and I think the full report is quite long, but I'll focus on 3 primary things that we wanted to learn and what we learned about those things. So first of all, we wanted to understand if business leaders viewed the concepts of productivity and performance differently. As HERO embarked on studying this issue, many people were wondering, well, is performance a subset of productivity? Is it the other way around? Are they interchangeable terms? And rather than assume as we proceeded with our work, we thought, let's ask business leaders what they think. And what we found is that business leaders recognize health as a significant contributor to both productivity and performance, but they don't view them as the same thing. And so what that said to us is we might need to continue to distinguish between these terms as we talk to business leaders. We also found that leaders, while they do recognize health as a significant contributor to these outcomes, they don't necessarily view it as a top driver. And so while 1 in 4 business leaders in our survey named workforce health and well-being as a top driver of productivity and performance, the remainder listed having appropriate resources to do one's job, having the right people in the right job, and employee engagement with their employer as the most frequently named top drivers. This was a very important finding for us because while it doesn't mean that business leaders don't think employee health is an important contributor, they do think it contributes. It's just not top of mind for them. And so this confirms some suspicions that we had that when business leaders think about what's going to drive productivity and performance in my organization, employee health and well-being isn't the lever they think of first in most cases. So this was a really important finding for us because there's quite a bit of evidence linking employee health and well-being with productivity and performance. We just need to figure out, okay, how do we elevate this in leaders' minds more? And then finally, we wanted to understand if business leaders differed in their attitudes based on their level of leadership. So, executives versus VPs, directors, and managers. And what we learned is that while most senior business leaders say that their organization is committed to improving the health of their workforce, middle managers are less likely to recognize this commitment within their organization. And this finding underscores the importance of addressing all levels of leadership within an organization. And especially when you're building support for workforce health and well-being programs and stating the business case, these findings indicated to us we may need to message differently depending on who we're talking to.
That's interesting. And, how do you think these findings align with what's happening today as far as, workplace wellness program adoption in employers?
Well,
Jessica,
one of the findings was that when we asked employers how they viewed investments in workforce health and well-being within their organization, we gave them a variety of options. We said, well, do you think in your organization business leaders view this primarily as a healthcare cost containment mechanism, as a core business strategy, as an investment in human capital, et cetera? And what we found is that the majority of them said that investments in workforce health are considered to be a core business strategy as well as an investment in human capital to a greater degree than healthcare cost containment strategy. And this aligns with a 2012-2013 Towers-Watson survey of global employers, which found that they were motivated to invest in workforce health and well-being as a matter of corporate responsibility and their desire to be viewed as a good employer. They also, in this Towers-Watson survey, recognized the role of such programs as a way to manage absence and worker stress. So this is aligning with that specific survey. We saw similar findings in surveys conducted by Aon Hewitt and Buck Consultants. Then in addition, a 2013 survey by the National Business Group on Health and Towers-Watson found that employee issues such as stress, obesity, and lack of physical activity were among employers' top concerns due to their association with higher absence. And this does align with our findings that health is seen as a key driver. So we found that while our survey allowed us to have a richer understanding of how business leaders are viewing these particular connections, the main themes were aligning very much with what we're seeing in the broader marketplace.
So, your findings state that about, 91% of business leaders see the productivity and performance relationship, but that they, might be slightly different concepts. Can you shed some light on what this might mean for wellness program practitioners? And, in your experience, do you have any examples of real-world programs?
Yes, to both of those questions. So this finding, this distinction that leaders are making between productivity and performance is important because it can help benefits professionals, HR professionals, to determine how to position the information and the type of language to use when presenting the business case within their organization. And as well, this is very much applicable to program evaluation metrics. So if you've got a performance dashboard or some sort of a reporting mechanism supporting your workforce health and well-being program, you might need to have both productivity and performance metrics on that dashboard or in those reports. And what's really important is that it requires understanding how the leaders in the given organization that you're looking at view these terms, because what we've come to find out is that different organizations view these things differently. So let me give you some examples. Business leaders at Schwan Food Company have a very specific formal understanding of what they consider to be productivity and performance, including defining what those terms mean in their organization and how the key performance indicators that they use measure business success. And in the report, which is available out on the HERO website at herohealth.org, people can go out and get the case studies that we include in this report, which includes organizations such as Schwan Food Company, Intermountain Healthcare, American Express, and others. So highly recommend people go and take a look at that. At Intermountain Healthcare, leaders position employee health as part of the organization's business strategy, and they align their efforts with specifically performance measures that make sense to their organization. And so they found that when they look at employee engagement with their work, that correlates highly with patient satisfaction, which is one of their key measures of interest, as well as participation in their Live Well program, which is their workforce health and well-being program. And so they're starting to pull these concepts together and distinguish how do these different things interact to support our business. And then a final example, at American Express, productivity is considered a component of employees' performance. So remember when I said earlier we weren't sure if productivity was a subset of performance or the other way around. At American Express, it's considered a component of employees' performance. But performance encompasses a lot of different factors, which are evaluated on the annual job performance assessment, among other things. And business leaders there understand that healthy employees are more productive and engaged in their work, and that unmanaged stress, lack of exercise, and obesity are global concerning their impact on productivity. And in fact, they've been linking their data up as well and have seen that a link between poor health and increased likelihood of short-term disability is a key driver for them, not to mention, that there's a decline in short-term disability when health status improves. So these kinds of connections are becoming more and more common, and I think each organization has to determine, based on the data available to them, how do they differentiate between these terms, and then how do they link the data up to show these important relationships.
Nikki, when you looked at this, is there a difference in how business leaders at different levels of leadership view employee health? So let's say a CEO versus a CFO, and then when you look at the company size, is there a difference in how the leadership looks at the health and wellness and productivity in different size companies at the leadership levels?
Yeah, that's such a great question. Thanks for asking it. I'll give you a few data snippets that will give you a better sense of what we saw as we segmented this data. Before I do, I just want to note that the full report that Jessica mentioned earlier in the call is available on the HERO website and has a lot of these breakdowns in terms of the overall segmentation. We got some really, really good data at the segmented levels thanks to the fact that we ended up having a lot of survey responses. So I would encourage people to go out to our website and check out the full report. In the meantime, back to your question, here are some snippets that will help people understand what the variations were that we saw across industry and organizational size, and also role. So starting with role, directors and managers are far more likely to indicate that senior leaders view health primarily as a cost containment strategy rather than an investment in human capital or even as part of the organization's core business strategy. We found that divergence to be very interesting at the director and manager level. Secondly, business leaders from the largest organizations, so some people might refer to those as the jumbos, were least likely to indicate that the organization's senior leaders were committed to the health of the people. But there could be an interaction here with leadership role, as the largest organizations were most likely to be represented by managers and by individual contributors. So that's something to take with a little bit of a grain of salt on that one. In terms of the business priorities that people believed were most influenced by employee health, The majority of our business leaders selected productivity, performance, and employee engagement with their job, as Jessica mentioned earlier. Interestingly, when you looked at that broken down by industry, you saw that business leaders representing government organizations more frequently selected benefit cost reduction and safety over employee engagement when it came to business priorities impacted by employee health, where manufacturing leaders favored safety as a top response. When you looked at business leaders from transportation or communications and utilities organizations, they also favored benefit cost reduction as a priority most impacted by health. One thing to note, where we see the majority of the work needs to be done, at least with this body of survey work, was really around middle managers who were pretty much a lot less likely to report commitment to employee health than were the senior executives. We really feel like there is a pretty big discrepancy happening with the people at the top levels of organizations and those people that are on the front lines, those middle managers. This observation really speaks to the importance of building support at every level of leadership within the organization in order to achieve the outcomes that you're looking for.
And Jessica, the business leaders you survey appear to be shifting away from health as a cost driver to thinking more about health as a business strategy. What do you think are the implications of this shift in thinking for the wellness industry?
Well, you're right. More than half of the survey respondents reported that health was viewed as part of their organization's core business strategy or as an investment in human capital. About a third of business leaders said health was viewed primarily as a cost containment strategy, and fewer still as an expense. And these findings are significant because they do demonstrate that there is a growing support for what we're calling a broader value proposition for an investment in workforce health and well-being. We're seeing this emerge quite a bit in the industry chatter. You will see, do we need to shift away from ROI and broaden our value proposition to more value on investment? So I think that these findings underscore for us that this focus on workforce health and well-being as a healthcare cost containment strategy, business leaders are already ahead of us in some cases. They've been positioning this within some organizations as a good way to do business. They also encourage health and wellness professionals to have more informed. They encourage us to have a different and more informed dialogue with executive leaders about the importance of understanding the interplay between health, productivity, and performance in their organization. And finally, these findings do underscore the importance of addressing all levels of leadership, as Nikki mentioned, within the organization. And I think even more than that, because of some of the industry differences that we picked up, I think this report can serve as a fantastic conversation starter with businesses. Taking these findings to business leaders within one's organization and saying, well, here's what these business leaders thought. How are you viewing these terms? And how would you why do you think that this company invests in employee health and well-being? And really getting the answers within an organization, because that might influence how you talk about the value proposition going forward.
Jessica, as we wrap up this segment here, and Nikki, I want to give you a chance to answer too. Kind of, what are some key takeaway points that our audience really needs to be aware of from this survey? And Jessica, you just alluded to one of them, but what are some key takeaway points as we wrap up this segment? We'll start with you, Jessica.
Yeah, so I'll just mention one thing, and Nikki, I'll allow you to add on another. So I think for me, one of the most important considerations is if we're going to broaden our value proposition for workforce health and well-being, supported by these findings, we also need to look at not just are we broadening what we think the outcomes are of these programs, but also that causes us to need to take a stronger look at what the investment is. Because it may be the case that for business leaders who don't see this connection, that consider investments in employee health as a healthcare cost containment strategy, they might be viewing the health solution or the wellness program very narrowly. And I think organizations that have this broader value proposition have a much more comprehensive approach to their program. And so it's important to consider the scope of the program. If you're looking at just physical health, pedometer programs, or the latest wearable technology, and maybe some incentives, biometric screenings, and that's all the business leaders view the program as being, they're going to have a different concept of what the outcomes of those initiatives might be than when they think about the wellness program, they're thinking of it as a program that addresses career, social, financial, spiritual, mental, and emotional well-being, which when many people consider what wellness programs were initially framed to be, it included all of those different aspects of health and well-being. And I think we're seeing a return to that. We're seeing a shift where we're reclaiming our definition of wellness, that no, it's meant to address all of these things. And when you've got a business leader that understands that what you're doing with your wellness programs is linked to some of these other concepts, they're going to much more readily accept a broader value proposition. Nikki?
Yeah, Jess, that was beautifully said. I think the only other thing that I would tack on, and it's directly related to the value proposition, is when it comes down to the evaluation of the wellness program. So based on how business leaders' views are on all of these topics, there really may be a need to differentiate productivity outcomes from performance outcomes and to identify the connections between employee health and other outcomes and business priorities like employee engagement with their employer, worker productivity, and performance. So I think with the enhanced value proposition and then with the evaluation of the wellness programs and kind of a broader view on that and a more inclusive view in terms of what are you really seeing as the business priorities being impacted, I think that this information can really help people reframe their thinking and strategies in those two areas.
Well, Jessica and Nikki, thank you so much for joining us on the program today. We look forward to having you here in Atlanta to talk even more about this at our conference June 23rd through the 25th. So thank you so much for joining us on the program today.
Thank you for having us.